Welcome to Sri BALAJI VIDHYAPEETH, Indira Gandhi Institute of Dental Sciences. Today we are going to see about Introduction of Indexes. These are the contents. First, the introduction. Dental indexes or indices are devices to find out the incidence, prevalence and severity of the disease based on which preventive programs can be adopted. An index is an expression of the clinical observation in a numerical value. It helps to describe the status of the individual or a group with respect to a condition being measured. And this is the definition given by Russell A.L. A numerical value describing the relative status of a population on a graduated scale with definite upper and lower limits, which is designed to permit and facilitate comparison with other populations, classified by same criteria and methods. Next, the ideal requirements of an index. First, clarity, simplicity, objectivity, validity, reliability, quantifiability, sensitivity, acceptability. Next, the criteria for selecting an index. Simple to use and calculate. Permit the examination of many people in a short period of time. Require minimum armamentarium and expenditure. Highly reproducible in assessing a clinical condition when used by one or more examiners. Not cause discomfort to the patient and should be acceptable to the patient. Amenable to statistical analysis. Strongly related numerically to the clinical stages of the specific disease under investigation. Next, the classification of indexes. First, based upon the direction in which their scores can fluctuate. There are two types: irreversible index and reversible index. Example for irreversible index is DMFT index. Example for reversible index is low and stillness gingival index. Next, based upon the extent to which areas of oral cavity are measured. There are two types: full mouth index and simplified index. Example for full mouth index is Russell periodontal index. Example for simplified index is Green and Vermeulen oral hygiene index. Third, general categories according to the entity which they measure. There are three types: disease index, symptom index and treatment index. The DK portion of the DMFT index best exemplifies a disease index. Symptom index. The index measuring gingival or molecular bleeding are essentially symptom index. 3. The treatment index. The F-filled portion of the DMFT index best exemplifies a treatment index. The fourth category, dental indexes can also be classified as simple index and cumulative index. A simple index is an index that measures the presence or absence of a condition. Example for this is stillness and low plaque index. And the cumulative index is an index that measures all the evidence of a condition, past and present. Example, DMFT index for dental caries. Uses of an index. Provide individual assessment to help a patient recognize an oral problem. Reveal the degree of effectiveness of present oral hygiene practices. Motivate the person in preventive and professional care for the elimination and control of oral disease. Evaluate the success of individual and professional treatment over a period of time by comparing index scores. For an individual patient, recognize an oral problem, effectiveness of present oral hygiene practices, motivation in preventive and professional care for control and elimination of disease. This picture denotes for an individual patient. Next, in research, determine baseline data before experimental factors are introduced. Measure the effectiveness of specific agents for prevention, control or treatment of oral condition. Next, in community, shows prevalence and incidence of a condition. Assess the needs of the community. Compare the effects of community program and evaluate the results. This picture denotes for a community. Thank you.